We're talking about breast cancer today and the treatment options. What options are available to women?
Well, the good news is there are more treatment options available to women now than ever in the past. The courage of many women who have gone before and leaders in our field who have asked difficult questions have led us to expand treatment options and have led us to improve outcomes in breast cancer. In fact, over the last 3 decades, clinical research and advances in surgery, detection, and treatment have resulted in overall about a 30% increase in the probability that a woman who's diagnosed with breast cancer today will be cured of that disease. And that's a really tremendous accomplishment. Breast cancer now more than ever is a multidisciplinary specialty, meaning that coordinated efforts of many different doctors and breast care providers are required to get those best outcomes. Treatment starts with the surgeon in many situations, but not all. And whereas 30 years ago, every woman underwent a very radical surgery, a mastectomy with extensive lymph node resection, these days we're often able to forego those radical surgeries and we're able to do lumpectomies. And again, rather than removing many lymph nodes, we're able to remove a single or a handful of sentinel lymph nodes. And so surgically, we do much better than we used to do, both technically in terms of cure, but also in terms of reducing long-term side effects.
Sure.
Obviously, there's been considerable advances in chemotherapy. We understand the biology of breast cancer better now than we ever have. And so in addition to traditional chemotherapy agents, we have new targeted therapies that often improve outcomes with very little increase in toxicity. And those have become standard parts of chemotherapy for women that have high-risk breast cancer. And while not every breast cancer requires chemotherapy, our ability to deliver that treatment, improve the chance of cure, and to do it in a way that minimizes side effects is dramatically advanced. We often use hormones in breast cancer. We take the body's own natural hormones and manipulate the environment to our benefit, because many breast cancers are sensitive or are fed or driven by estrogen. And if a woman has a breast cancer that's driven by estrogen, one of the most important maneuvers that we can offer is to deny that cancer estrogen. And most often that's done in a pill form. So a pill a day to deprive this cancer of the estrogen it needs, turns out is one of the most effective treatments we have to prevent breast cancer from coming back. We continue to push the envelope in terms of radiation. Radiation is often used as an adjunct to more limited surgery. And that combination of radiation with a more limited surgery turns out is just as effective as doing a more extensive surgery or a mastectomy. So there really are many components to the treatment of breast cancer in this day and age. There are more choices than there have ever been. And while sometimes those choices can be daunting, it's good that we have them. And it at the end result leads to more women being cured of breast cancer and living productive, normal, full lives than at any point in our past.
If you had to say one comment to someone watching this video who's maybe just been diagnosed, what is that simple message that you give them?
Well, I think the first thing I would tell anybody diagnosed with breast cancer is that it is natural to have some fear. It is natural to go through the range of emotions that people go through when confronted with a cancer diagnosis. But my piece of advice is take charge of this disease. Become educated. Seek out all the resources that you can, because knowledge really is power. And understanding the advances that we've made in cancer medicine in the treatment of breast cancer will lead to a replacement of that fear with hope. And that's really what we all need to move forward in our lives.